Stephanie from InMotion Physical Therapy, and today I'm going to talk to you a little bit about TMJ disorders. So TMJ disorders is kind of broad because it can affect many different people in different ways. So it can be anything from jaw pain, ear pain, difficulty opening your jaw, a locking sensation, clicking, popping, grinding, all different kinds of motions that occur within the kind of jaw region, and also headaches. So when anything affects kind of the whole head, neck, jaw area, it can be really debilitating. That's kind of all you think about, because every time you're talking, eating, you remember that something's wrong here. So we'll kind of go back a little bit and talk about what the TMJ actually is. So it stands for temporomandibular joint. So it's a joint that connects your jawbone up into your skull, really. So it's kind of a hinge joint, and it allows for different actions, so moving your jaw forward and backwards as well as sideways. So all of these, different motions are so important to be able to speak, for different facial expressions, chewing, swallowing, so things we're constantly doing. So when this is something that you suffer from, it is something that really affects day-to-day life. So this can be kind of start from different reasons as well. A lot of people initially will just have some sort of oral dysfunction. So that can be anything from sucking your thumb when you're younger, biting your fingernails, clenching your teeth, grinding your teeth, smoking is a big one. So things that you've heard not to do for a long time, and this can kind of be something that results by not stopping doing those different techniques. Also, trauma is another one. Obviously, getting hit or any direct trauma to the jaw, to the head, can also lead to dysfunction within this joint, as well as different arthritis or connective tissue disorders. One of the reasons that is because there's actually a disc in between where the jaw is that can cause that disc to kind of break down. So the disc sit between those two joints should help absorb some of those forces, allow for the movement of the jaw to be really smooth and controlled, and sometimes it just gets off. Either the disc can kind of go forward or backwards or sideways, or just kind of break down, and it doesn't really help to absorb those forces as it should. So obviously it can lead to all the different dysfunctions that I mentioned in the beginning. So with physical therapy, we'll first kind of work on controlling that pain, different modalities to kind of decrease the inflammation. We'll actually do intra-oral release, so we'll get inside your mouth and kind of change different positions of your jaw, the muscles of your face, so we will be able to actually work within that jaw structure, as well as education. Education is huge on changing diet, sleeping patterns, those different oral dysfunctions that we kind of mentioned earlier, making sure that you're able to control the opening and closing of your mouth. And often it also relates to different cervical problems, so that's all the neck disorders. Typically there's a combination of someone that has neck pain or something wrong within their upper spine and the jaw issues as well. So come on in to Motion O.C. and we'll give you a free consultation, really a thorough evaluation of kind of what's going on and how we can best help you.